record. Okay. Okay.
Oh, got it. Okay.
Sorry.
So my name is Younie. I'm the director of the Division of Developmental Disabilities with the South Dakota Department of Human Services. Our division operates services for individuals with intellectual and developmental disabilities. I actually live in Rapid City. My family has lived here for about 15 years. My husband's a police officer. We have 2 kiddos. I spend a lot of time around the state and especially in Pierre as well. The division as a whole is statewide. So we have an office here in Rapid City. We have an office in Pierre, in Sioux Falls, Winter, Aberdeen, and Redfield. So we are a statewide team. We are a small but mighty team, I like to say. Essentially, the role of the division is to facilitate federal and state funded services, and we operate, again, 2 Medicaid waivers. So a Medicaid waiver essentially allows states to target a subset of the larger state Medicaid population. And for us, that's again, people with intellectual and developmental disabilities. And so that is solely what our division services are focused on. And all the support is focused to individuals with intellectual and developmental disabilities. We specifically offer 2 types of services. So one is Family Support 360, which is more of a self-directed. It encourages people to stay with their families or in their own homes. And then there's another service called Choices, which is affiliated with a provider, and they offer more of a 24/7 type of service, including like a residential service. Have you heard of those services, or are you familiar with either of those? Yep. Okay. So essentially that is our services. You know, as a state, we are really focused on having person-centered plans, making sure that services are focused on the person, and that person has the support to live the life of their choosing. And so everything that we do is really focused on that and ensuring that services support families and people. So that's really our main goal. In the last 7 months, there has been a significant shift in services, how people are able to access services, and the transparency of that. And so that's something that we are very proud of. So when we first started, and Ruthie was talking about Dakota at Home, that is a new entry and the single point of entry for services, referrals. If somebody just has a question about resources, it's essentially a one-stop. And this was years in the making, because we had heard from families that it was awful. If you're familiar with the previous system, you know, we have various providers. And so every time a person would make an application, they could potentially have 20 different applications to complete. That's 20 different times of telling their story, 20 different times of gathering data, like just not a good experience. And so we spent a lot of time with a work group to design what that workflow should look like. And it went live in June. So whenever you are asked, or somebody's asking about what our service is in South Dakota, giving that Dakota at Home number is going to get them the most comprehensive help to answer their questions, or to inquire specifically about what might be available, what's available in their area, all of those things. They can reach a live person at that number. And so I don't know if you guys have already shared that, but it's 833-663-9673. And then for DD services, you would specifically select option 2. If you forget option 2, you're still going to get connected to a live person, and they will help also, you know, kind of wayfind and get you where you want to go. But that is the most comprehensive way to get connected to services in South Dakota now. Do you guys have any questions on that?
I was gonna ask about where does shared living go in that program? Because like
Oh, that's a
Sobrowski's
good question.
have Sobrowski shared living there, so they're probably
Oh,
familiar with all this too.
fantastic. Shared living is a wonderful program. I mean, we have a lot of great programs, but shared living falls under the choices waiver. And that is kind of what we would consider the most self-directed type of residential service in the choices waiver. And that service, I think, came about in 2018. And then within the last couple of years, we did a big adjustment in how services are paid and how they're defined. And so one of the things that we did was based off feedback about access to shared living, we made changes to that to make it more accessible and make it more accessible service across the array of participants. And so that has really opened up since June of this year also. What other questions do you guys have? We just updated our resource guide. And so as soon as that's available, I can send you a link. It will be on our website, which is also recently updated. If you have ever been on the previous website, it was like, I'm not exaggerating, probably 20 clicks to get to maybe something that you're looking for, and that's not the case anymore. So we will be sending that out to the printers shortly. And so as soon as that's available, I can make sure that you guys have access to that updated information too. What else?
Amber has
go ahead.
had the phone, like when people call looking for Autism Society, she's had to take the calls or reply to messages. So I know that she's definitely glad to have, like, to connect them to that Dakota at Home. That's just an easy, like I said, one stop. That's awesome.
Yeah. And what's
it really is, and everyone that I've given the information to is very thankful. So
oh, good. And one of the great things about changing that process is the information goes into a database essentially, right? So if that person calls just to get information and then decides to call back later, there would already be information about what their services are that they might be looking for. And so they wouldn't have to go through what can sometimes be a really hard information to share. They would already have some of that in there. And so that was feedback on the design specifically from families. And so we're really proud of the work. And of course, we have measures in place to make sure that we're meeting the expectations of or people that are calling, and also just making sure that, you know, the feedback, there's a survey and things like that after a person calls that number to make sure that we're continuously doing improvement on that process, because it is still new, specifically for us as well. So. Anything else? So I will get you the resource guide when it's updated. I can also include, well, in that will also be a general email to the division. But right now I would still recommend calling that Dakota at Home number, because it's going to connect to a live person, which, as we know, is the preference, right? We don't want to have to leave a message or perhaps talk to, I don't know, a robot. It's just nice to have that personal touch. So I would offer, if you guys do want to meet in person, because I heard that part of the conversation, I could maybe help to see if we can help find a location that would be free to meet in as well. So keep me posted on that.
Sure. And I just think when we mentioned that we're looking for a spot, and then you know that, and then you're like, oh, you know, and it's like you put your little feelers out, and we'd kind of talked about maybe looking around at like School of Mines maybe has some meeting place that we could, because it kind of, we have a couple options, but somebody's got to unlock a door or somebody's got to
right
a long ways. And so we thought, okay, downtown is good, but we didn't do that.
Yeah, I think the library has at least one meeting room that I think is also free to use.
And we usually have to meet though on a weekday, like after 6, and then they only they're only open till, you can really only book it till 6. So I think that's the library is a good idea, but yeah,
Well,
let's
I'll do some digging and I'll send anything that I find your way.
yeah, just keep it in the back of your mind anyway. And it's like, when you do that, something will bubble up.
Yes, for sure. Anything else? Well, if you're like me, you're probably going to think of things afterwards. So if you do, Ruthie knows how to reach me. I'm always open to answering any questions or visiting again, if you guys think of anything afterwards.
Sounds good to me. I don't really have any thoughts or questions. Life's pretty good here. With shared living for us. So
Good.
our son works every day and he gets all kinds of other supports, and we have him involved in Special Olympics, and now he's doing dance every Wednesday. So
Busy.
we're doing good.
That is wonderful.
Right, Tony?
Well, certainly if you guys have specific questions, or if you want me to come back and talk about certain services, I can sure do that as well.
You don't get involved in like school district stuff, do you?
It depends on what it is. So we have various staff that could potentially come to like some of the IEP meetings, or depending on what the topic is, to kind of help advocate. And we can certainly connect families to other agencies, like sister agencies, that can also do that if, depending on what the situation is.
Yeah. Every now and then we get calls, especially because our kids are a lot of times high functioning. And so then it's hard for school districts to figure out what services are appropriate. And so
Or to agree to even meet to figure out.
Yeah.
Yeah.
Yeah. So we have a
Yeah.
couple resources in town, but I know, like, is it disability rights?
Yes.
Is that this kind of sister thing?
Yeah, so Disability Rights of South Dakota would be considered one of those sister agencies, and their focus is advocacy. And so they would be one. South Dakota Parent Connection would be another agency that we would probably connect to. They have navigators that kind of help that system at the state level, depending on what the situation is. There's times where we've gotten involved, and then we work with the Department of Education, depending on the situation, to try to either wrap more comprehensive services or to advocate for particular things for students. And so sometimes we bring in Department of Education to help with that when it's been more challenging for families. But again, that Dakota at Home, that would be appropriate to call there too, and they would be able to help. Or you can reach out to me.
Connect to the Dakota at Home would connect you to the sister agency or whatever needed to happen.
Yeah.
Cool. I'm trying to think of other things that have come up over the past really like year or so that we've wondered about or haven't. Like you said, we'll probably think of stuff after.
Yeah.
Or maybe if, like I
always
said,
happens to me.
yeah, and if I post this, maybe people will watch it and something will come to mind. And
I
then
have a question. What about guardianship, like helping parents navigate that question and applying and achieving it?
Yes. So if there are questions specific around how, the future of guardianship, or if guardianship is the right fit, I would recommend Connie, Disability Rights. They would be a great resource to help really analyze that particular situation and provide some guidance on that. They're
I
more
know
of a legal entity.
It's like you were saying before you improved your computer, your call-in, that I know there's like a $500 scholarship you can get to help towards attorney fees, but a lot of parents have trouble navigating that, and so it takes a lot of clicks, as you said, to get there. And I'm a school psychologist, and I've tried to help a couple families, but it's not something I do on a regular basis, and so it'd be really great to have somebody that could help with that.
Absolutely. So Disability Rights, or again, that Dakota at Home, depending on what specific with guardianship they're looking for. If it's just a general question, starting with either of those places, they won't go wrong.
Great. Thank you so much.
Yeah.
There are a lot of resources out there today that weren't there 30 years ago when we started this.
Absolutely. I've been in the DD field for about 20 years, and it's been really fantastic to see how services have changed to meet the ever evolving needs. It's really fantastic.
Well, you and your mighty team have had a big part of it. I mean, I've only attended a couple of the state meetings, like there's a family support like council, and the stuff that you guys are doing and reporting on and data that's collected, like.
But we
I
honestly couldn't do that without advocacy groups and parents and families saying, hey, this we need to do this in a different way, or this is working, but let's do more of it. We really rely on our partners to help us steer where we should be going. And so we wouldn't have any of these things without those folks, for sure.
I like the website.
Yeah, it's nice.
Pretty easy to navigate. I'm just thinking a lot of these different services you've talked about, like Dakota at Home and disability rights, we should put links to those on our website to point people to.
Absolutely.
We have, I'm just looking to see what we have, and we don't really have anything out there that.
I think
No,
that's a great idea.
we have a links page, and there's a bunch of stuff on it, but not a lot of. Well, there's South Dakota Parent Connection, Black Hills Works, Children's Care, but these others could be added.
Yeah, so in South Dakota, there's what's called like the DD network is what that's called. So Developmental Disabilities Network. And it's essentially it's a three-legged stool is what I think of it. So disability rights is one of those partners. The Center for Disabilities, which is a part of the University of South Dakota School of Medicine, is another one. And then the Developmental Disabilities Council, or the DD Council, is the third part. And so they are, those would be also additional resources, Joe, that I would recommend if you guys do decide to link. They would be additional. They offer, like I think about the Center for Disabilities, they do a lot of trainings and information sessions, which would be geared towards families, but also professionals. So depending on, what a family's needs might be, or if they want to have a team go to a specific training, that would be a great resource to connect folks to.
And that's under University of South Dakota.
Yep, School of Medicine, and then it's called Center for Disabilities, and it is in Sioux Falls.
Yep. We're out.
I just thought of something else, Joey, that we were talking about, just as far as the study that I think Arlene reported about, and that was through the DD office, right? And it was about like mental health. I mean, it was a big study.
Yes.
Will you say a little bit about that?
Absolutely. Yep. So we worked with the DD Council, and then the Center for Disabilities, Disability Rights, and then Behavioral Health with Department of Social Services, to really do essentially a gap analysis of the behavioral health system as it pertains to individuals with intellectual and developmental disabilities. Historically, those services there's been a gap. So it's difficult to get access to services if a person has what we would call a co-occurring or a dual diagnosis. So somebody who has a developmental disability, but also a mental health or behavioral health diagnoses. Historically, and not just in South Dakota, it's difficult at times to get access to those services. And so we worked with an agency to do essentially a deep dive analysis. And I don't know, maybe some folks were a part of that because it included interviews and focus groups, but essentially they released a final report. And then based off the recommendations from that final report, there's going to be some next steps. So those next steps include like a professional learning community, as well as a subgroup that's going to be formed. And the DD Council is really taking the lead on that. But the subgroup's going to be formed to look at that report and kind of run it through the lens of South Dakota. What do we have now? What can we build on to help eliminate that gap? So that's one study. We also had the family support study. So I don't know if anybody was able to participate in that, but that happened from June to November, essentially. In November, they released the report, the final report of that study. It also really pulled feedback from families and advocates around their service experience as it pertains to the family support services and shared living in particular. So there was multiple interviews, multiple focus groups. That final report was released. The division is going to be working with the Family Support Council as next steps. And the council meetings are open to the public. So please feel free to come, or if you've reviewed it and you have other feedback, we're going to work to get some focus groups and some other things going too, to kind of keep that momentum going for both of those things.
For the mental health and the dual diagnosis part, that action do you see changes upcoming in the next year, 2 years, 5 years?
I do, because at the national level, there is work that's being done to really open up that access, because it's an equitable access issue, in my opinion. And so I know that we have commitment from state partners to help carve out what that will look like for us in South Dakota. We're fortunate. There are some states who aren't able to really get some of that traction. And so we're optimistic that we're going to be able to really make some progress and some movement towards that for folks who have, that dual diagnosis.
Yeah. Thank you.
Yeah.
Anything else? Otherwise, I just got to notice that our meeting will end in 10 minutes, which.
Oh, no, I'm sorry. I could probably just talk and talk.
No, we wanted you
Anything
to.
else happening
Hi,
here?
Patrick.
Oh, dear.
Yeah. Why don't you call the Geek Squad? Maybe
Yeah.
they could
You
help
guys
us.
think of anything else?
What do you mean?
We
There's
can
Well,
go
I
live.
just noticed-
Here, look at this.
I just noticed we had some
What's
people
that
join us.
say? Oh, password.
I know, but I did put, I gotta put it in again. Oh, for pity's sake, why
Yeah.
didn't they say
Can
something?
I read that
Mike-
for you? Oh, you got it.
Yeah,
Mike
no, I
and
did.
Laura.
Yeah.
I don't know.
Mike, Laura.
Oh, thank you, dear. Been
Mike,
working
can you
on
guys
it
hear
for
us?
maybe 2 months now.
Yeah.
Unmute. It says ask
Okay,
to
I hope I'm
unmute.
doing this right. Okay,
I'm
we'll
sure
see.
you
Now
are.
I'll log in again. Boy, they're
No.
hey, look at that.
Is that it?
I guess so. Yeah, the Happy
Hi.
Hoffmans, of
Oh,
course.
wow.
That's us. Okay.
Sure, a lot of beautiful people on the screen over there.
Hi, Mike
Well,
and
honey,
Laura.
you're-
Can you
Is
hear
that
us?
all our
Stuck
fans
on
on this?
yourself. Yeah, no, no, that's us over there. But
Oh, that's
look-
us.
yeah, look at